Hospitals in the Western Cape are under pressure from rising COVID-19 patient numbers. It's putting a strain on ICU beds and other resources. The Western Cape Health Department has warned that if this continues, there could be a delay in admissions of patients and other essential services. On Friday, there were more than 2,000 COVID-19 patients in the Western Cape hospitals, and more than 200 of them were in ICU. Many of the hospitals in the province are nearing full capacity. Western Cape's Premier Alan Windy joins us now to tell us on the situation on the ground. Premier, good evening, and thank you very much for your time tonight on News at Prime. You're making some changes to your current service delivery in the health services sector. Visitations are being restricted, non-urgent or outpatient appointments are postponed, non-surgical elective surgery will also be postponed, and patients who are in hospital but are stable will be discharged. Is this a sign of some pressure beginning to emerge, and should we make anything of it?
Well, I think definitely yes. Obviously, as the numbers start to rise, you said just over 2,000 on Friday. Well, now we sit on Monday and we're sitting at 2,503 people in our hospitals, 323 people in our ICUs, and that is across public and private sector. And we can feel the pressure in both areas, private and public. And of course, this again, as you've said, we've had to re-look at our protocols in our hospitals, no visits whatsoever. As we move certain wards, because you can't just put a patient into a ward if they're COVID-19, you have to then create a whole ward that is COVID-19. So more and more wards now need to be made for COVID. We also have extended other field hospital beds across the province as we are dealing with the increase in infections across the province. And it's all about management. And I think two areas. As we get more and more COVID-19 patients in, we have to make decisions on the existing patients in our hospital. And then, of course, the other area that we warn about often is the trauma cases. Now, trauma cases are alcohol-fueled trauma. It is car accidents. People are traveling at the moment. We really say, please travel safely. Be careful of your alcohol intake. Abuse of alcohol also ends up causing trauma in our hospitals, and that really puts pressure on our ICU beds. And so it's trying to find the balance between the two all the time. And again, calling to the citizens, you need to play your part. Masks on the bottom of your chin as a chin warmer, that's no good. Masks under your nose as a moustache, that's no good. You need to be social distancing, avoid crowded areas. You've got to help us in creating the balance. So definitely we can feel it in our hospital system.
Yet you're still calling for the beaches to be open?
Yes, I must still say that I believe that open beaches, open spaces, fresh air and parks, especially I think poorer people who are in more densely populated areas, how do you get out into the open? That is definitely much more advantageous than being in shopping malls or in closed environments. Quite frankly, we since getting the messages on Friday of this new strain of virus, we've asked our epidemiologists during the weekend to have a look at the modeling again. What does that mean for us? If the infection rate is higher, what does it mean for us? We've always said we don't want to run out of beds, so we have to make these decisions. But again, it says, please don't be in congested, closed environments. Be careful how many families you're putting together in this festive season. Keep those numbers down, because people congesting pushes up, and people congesting indoors is much more dangerous. So, rather send one person to the shops, don't go the whole family to the shops. Try not to spend time in the malls. We really need to look at those areas. That we must base it on the science and what the science says to us.
Now, have you considered then resurrecting the Cape Town International Convention Centre field hospitals at this point?
So the big problem with just putting extra beds in place is not actually the beds. It's actually the manpower, the nurses, the doctors. Have we got sufficient nurses and doctors? And that is a big, big problem at the moment across South Africa. We don't want to be caught short. We've seen in other provinces, you've got the facilities, but you can't man them. What we've also done is we only closed the CTICC. We never closed the Brackengate, which we now call the Hospital of Hope, those 338 beds. In actual fact, we've got about 690 beds either in place or just about in place. So we've created extra wards across the province, turned storage rooms into wards. We've opened up extra wards in, say, for example, in Mitchell's Plain, and some in partnership, some where we're actually just going ahead and putting other wards in place. Also, we spoke about the decanting, people that we're decanting out so that we are creating extra spaces. So 690 beds now on the field hospital space. And really what's under pressure now are our frontline staff. And so, I also say that's the message. Please, everybody, we've got to play our part. Think about those nurses, think about those doctors who are putting in hours and hours and hours every single day. We need to think about their well-being. They've been doing this for months and months and months now. So we need to play our part because we really are relying on them to play their part.
So, Premier, let me hear if I've got you clearly. You're saying you will not be resurrecting the ICC. However, you will make up this capacity elsewhere. Where exactly?
Correct. So, as I said, we will make up the capacity. We've got the 338 beds field hospital at the Bracken Gate, which we call the Hospital of Hope. We've built probably another 190 beds at Mitchell's Plain. We've got extra hospital beds that we've put in across 20 here, 30 there, 40 there, across all of our hospitals from Vredendal to George. We've got extra beds in many, many places. Some of them would have been existing, for example, TB infrastructure, for example, in the Winelands, that we converted into field hospital wards. Then when the flattening of the curve came, we put TB patients back in again, but now we've put it back into COVID-19. So at the moment, 690 beds, field hospital beds. But as I said in the beginning, it's not the number of beds that's the problem, it's the staffing. Yeah. We've got to make sure that we've got sufficient staff to manage them. And again, maybe even that's a call, just say for volunteers. We've got a list of volunteers. If anybody else wants to come along and help, please. Frontline staff are in need of help all the time.
And of course, these are beds with oxygen points, I gather.
Correct. Even sometimes in some of our hospitals where we are feeling the pressure, some of our doctors are even over the weekend, I know they're very quickly rigged up oxygen points. So even people waiting for a bed as we're decanting or as patients are being discharged and new ones coming in, we're even rigging up oxygen. So even while you're in the waiting room, you can sort of run 4 people off an oxygen tank. So, I mean, I must say the inventiveness and the innovation astounds me every single day. We've got an amazing team, especially in this emergency medical space. But yes, we are feeling the pressure, and we really do call the citizens to please, you need to play your part in this deal.
You're talking of fatigue setting in as well on health professionals. Let's talk about non-elective or non-urgent elective surgery being postponed. This almost takes us back to lockdown level 5, where we saw this happening, and it created a whole lot of a backlog. Was that backlog addressed?
Yes, well, and that's the sad part. We only started to get the backlog back. And the real issue for me is when this happens to us, making these management decisions, is you start seeing things like the inoculation levels. You start missing out on inoculations. I think people suffering from cancers don't necessarily get into the system as soon as possible. And then, of course, as you said, the non-elective surgeries or the non-urgent patients, those are the patients that we try to discharge early. We try to triage differently. These are the difficult decisions that our doctors and nurses are making every single day to make sure that we have enough space, that we're not going to run out of beds. And of course, they all come at a cost. And, when you push something out, it's got to happen later. And of course, it also has an effect on the patient too.
Now, looking at all these numbers and look at all these variables and the fact that we are now dealing with a variant bug that is no longer conforming to what we know the COVID-19 bug to actually behave like, is it not time to call for maybe extraordinary measures?
So we've asked our epidemiologists to run the models again. I've actually called for a cabinet meeting tomorrow morning where we will be updated as a cabinet on where we are. We've also got what we call the PCF, the Premier's Coordinating Forum Management System. So tomorrow at 10, I meet with all the mayors, the municipal managers across the districts with the health department and law enforcement, police, our law enforcement officials to get to understand what it's like across the length and breadth of the province. where the issues are, so that we can make further decisions. And then we've also got a meeting tomorrow afternoon with the Health Minister, Minister Dr. Zweli Mkhize, also to update him on our position, where we are, and to get his input. I must say that I am encouraged in the garden route. We've started to see a bit of a plateauing in the garden route. I see definitely the hospitalizations are coming down, and I see the infections rate is coming down. So that for me is good news. But of course, as it starts to drop in one area, you start to see it coming up in the other area. And so for the moment, it's the metro in the province, the city of Cape Town, as well as the Winelands area. So we will be discussing all of this at the next cabinet meeting tomorrow morning at 8, as well as with Dr. Mkhize at 2 tomorrow afternoon.
Premier of the Western Cape, I appreciate your time. Thanks for joining us on News at Prime. That's Alan Wendy there for us tonight, addressing us on the situation and plans on the ground in the Western Cape.